Hi, Dr. Yen. Thanks so much for joining me on the Slice of Healthcare podcast.
Thank you so much for having me. I'm excited.
I'm excited to do this. We've had some conversations. I'm glad this is only the second video that we've ever done on Slice of Healthcare, so you should feel special. This
I
is
do.
this is still new to us, but it's I think it's much better for the audience to be able to see us speaking and get to hear about your company from you live, right? So let's kick things off. If you could tell the audience a little bit more about yourself, and then we'll go into talking about Pandia.
Yeah, like we sort of discussed before, I'm Dr. Sophia Yen. My mom said always claim all your titles, especially if you had to go to a lot of school and pay a lot of money to get there. And I went to MIT for undergrad, UCSF for medical school, Children's Hospital Oakland for residency, back to UCSF to specialize in adolescent medicine. So teenagers, young adults, what we call sex, drugs, rock and roll, a little acne, and some sports medicine. And then went to UC Berkeley to get my master's in public health and specialized in maternal child health, obesity at the time. And then went off to Stanford, where I'm currently a clinical associate professor in the Division of Adolescent Medicine in the Department of Pediatrics. However, about 4 years ago, started Pandia Health. And Pandia Health came up with the name, Greek goddess of healing, light, full moon, and then made up the definition. I think it's fate. Pan is every, dia is day. So we got you covered every day. Set it and forget it. Let Pandia worry so you don't have to. And we're building the brand that women trust with their health, starting with birth control, something that if women run out of, their hair is on fire. And I actually coined the term pill anxiety. If you imagine a pack of pills and you get to that last week, if you don't get to the pharmacy by this day, there will be a dire consequence. And women suffer this pill anxiety 1 week out of 4 for 20 to 40 years of their lives. So Pandia Health's goal is to make sure no one runs out of birth control on our watch. We deliver birth control by mail, and then we also have an online doctor's consult if you need it. But we're perfectly happy that your doctor write the prescription. We're just here to do the delivery.
Thank you for that intro. Appreciate it. I love the name. I love whenever there's Greek mythology behind a name, and then combining those two parts of the word, which matches up really well with what you built with your company. So that's really cool. Big fan of the brand. I would like to, if it's okay with you, I'd love to hear more about the pill anxiety. This is not a space I know anything about, but
Yes.
I would like to know, like, what is the consequence, besides obviously the obvious, but what is the consequence of if someone's just like, yeah, I'm gonna miss a couple days.
Yeah. So the pill anxiety is real, and it's even magnified by the difficult situation that insurance companies put women in. So for example, you can imagine you get to this last week and then you had time on Saturday, Sunday to go, but the insurance company will only let you get it 7 days before. And that 7 days starts on Monday. But you got work, you got kids, you got meetings, you've got, podcasts you got to do. When do you have time to run to the pharmacy? And so as you get closer and closer to this day, you are flipping out. And the longer you extend this placebo week or time off of it, you risk pregnancy. And then women are also using this for things other than birth control. So at Pandia Health, we're also trying to destigmatize birth control, make it not for birth control, but for hormonal treatment, that you can control your periods, that you can decrease painful periods, that you can decrease polycystic ovarian syndrome, endometriosis, and just life is better with smooth hormones. So if you disrupt this smooth hormone, you will get blood, or you will get pain, or you will get acne, or you will get endometriosis, or you will get a cyst in your ovary, just all these bad consequences. And women have been flipping out every single month on average for 20 to 40 years of their lives. We calculate women spend 10 weeks of their lives going to the pharmacy, waiting for the medication, coming back home. And I'm all about hashtags. So hashtag better things to do than to freak out, worry, have to go to the pharmacy, waste your time. It should just come in the mail. And that's how my friend and I came up with this idea. I was giving a talk to a bunch of doctors. Why don't those pesky women take their birth control? The top reason that came up, didn't have it in their hand. And I was like, we'll solve this. We'll just ship it to you and keep shipping it to you until you tell us to stop. So that is Pandia Health. We ship it to you. We worry about your evil insurance company. As soon as your insurance company allows it, we ship it out the door. Our stress, not your stress. Automated, with a computer that won't mess up, hopefully. And mantra, no one runs out of birth control on our watch, to the best of our ability, as long as your insurance company isn't evil. And we'll ship 1 month, 3 month, or a year supply, depending what your doctor wrote for, what your insurance will allow.
Perfect. Can you talk us through, I guess, let's say how it works for a consumer then, from step one until they finally get it delivered?
Yeah.
What does that look like?
So there's two different paths. One is I already have a prescription and I just am tired of running to the pharmacy every single month, tired of pill anxiety. So all you have to do is tell us where it's at. We move it to our partner pharmacy. You give us the front and the back of your insurance card. We bill your insurance, ship it to your door, set it and forget it until that prescription runs out. 2 months before the prescription runs out, we go, hey, go see your doctor. You need to refill this prescription. A month before, hey, go see your doctor. And then every week and every day until you run out, go see your doctor. So we're not here to break your doctor-patient relationship. We just want to make sure no one runs out of birth control on our watch. Option
so you're providing
two.
that. Oh,
Go
sorry.
ahead.
So in that scenario, you're providing that tap on the shoulder, like until they actually go and complete the
Yes.
action so that they're getting that. Okay.
Exactly. And what we're doing is we're taking care of you until the prescription runs out. So a prescription is generally a year. So we're mailing it every month, every 3 months, every 6 months, again, whatever your doctor wrote for, whatever your insurance will allow. And with it, we send you a freebie, a goodie. So sometimes chocolate, candy, discount off of a vibrator. We work with a lot of female founded companies to highlight them and give them free exposure. That's all free. And then we also throw in a Pandia public service announcement. Like, did you know if your body mass index is 26 and you're taking plan B, that's as good as water. So don't be doing that. Use Ella instead, which is a prescription emergency contraception, the only one out there, and it works better for higher BMIs and at every time point. So that's option one. Option two is, holy crap, I can't get into my doctor's office. COVID has shut everything down, or I just moved to a new city. I don't have a doctor. I need a prescription. What am I going to do? You just pay us $20. We just dropped our prices from 30 because of COVID and to be nice to people. Once a year for 364-day access to our passionate, experienced birth control expert doctors. And then you answer a bunch of questions, same questions I'd ask you if you came into my office. And then you give us a self-reported blood pressure from the past year. You can either call up your doctor's office and say, hey, what was my blood pressure last time I was there? Or go to a grocery store, a pharmacy, or you can go to the fire station. They're all EMTs and they can take your blood pressure, of course, with physical distancing to the best of your ability. And then our doctor looks at it. You just fill out a questionnaire. You don't have to make an appointment. You don't have to do video or phone, which you can imagine would be embarrassing if I had to ask you so is there any chance you could be pregnant? And you're like, no, there's no chance I could be pregnant. I'm sorry, I couldn't hear that. Could you say that a little louder? No, there's no chance I could be pregnant. I haven't had sex in 6 months. And you're like, ooh, either in your house or at a coffee store or in your cubicle, right? So this is all done on a questionnaire, 24/7, your convenience, confidential. Our doctor looks at it. If it looks good, write the prescription, bill your insurance, ship it to your door, set for the year. And if the doctor has any questions or concerns, we will absolutely contact you. We have texting, we have a secure messaging platform. We can also do it by phone, but we will always be HIPAA compliant. So we won't expose your data anywhere that would violate anything. We are the only women-founded, women-led, the only doctor-led company in this space. So I'm the only CEO in birth control delivery that has taken the Hippocratic Oath, do no harm. And so I'm very aware of HIPAA, and we will always tell our customers what's best for your health, even if it's not best for our bottom line, because I know I can make money and I don't have to make it off of selling you stuff you don't need or stuff that's not good for you.
That's good to hear. Yeah, it's interesting when you acting out the phone call with the potential embarrassing information. Yeah, it's certainly nice to be able to for people not to have that information out in the open, right? To go through a secure platform like you've built for that.
Exactly.
What has been, I guess, let's take it two ways here. How has COVID, I guess, negatively and maybe positively affected the business? I'm guessing it's been more positive because
Yes.
people can't, really
From
go in person anywhere. But
Yeah, so from the business point of view, COVID has done very well for our company because now telemedicine is everywhere. Telemedicine is far more acceptable, and people are realizing, I don't want to go to the pharmacy for the infectious risk. We were pitching it for you're wasting 10 weeks of your lives and you're stressing out. And people find it really difficult to believe that our service is free. In our service, we charge you nothing for the delivery, for the PSA, for the freebie that we throw in there, for the Pandia peace of mind that we'll worry so you don't have to. And people ask, how do you make money? We make money the same way your pharmacy makes money. The difference between what we buy the birth control pill at and what the insurance company will reimburse us. But we also have cash payment options for those people who don't have insurance, and we try to keep that as low as possible. It's $15 for a pack of pills, which a brilliant person realized is 50 cents a day. 50 cents a day. So quite reasonable for that. And so COVID has made people realize, I don't want to go to the pharmacy. And COVID has unfortunately shut down a lot of primary care providers' offices. And so if you're new to an area, you can't get to a doctor to write you a prescription, and the other one is in a different state, and it's illegal for somebody in a different state to prescribe in this state, except for cases of emergency. It gets all complicated. So a lot of people have come to us, and a lot of physicians have come to us saying, my office isn't open, and I also don't want my patients to risk going to the pharmacy. Why don't you deliver it? And we're like, yes, you write the prescription, we'll do the delivery. Tell all your patients about us. Again, the only doctor-founded led, women-founded led company in this space.
Interesting. Wow. That's yeah. So it's one of the things when I talk with these digital health CEOs is the biggest thing that COVID did was it, as you just said, it increased adoption of an already very useful part of healthcare.
Yeah.
I mean, it's crazy to say this, right? But it took a pandemic to really push continued adoption. And this will, I mean, I believe, I'm sure you agree, that this will continue even past COVID.
Yes.
People experience, it's just like you're seeing with like grocery store, right? Shopping from your phone. People are getting used to doing something a certain way. And if you can do it on your phone, everyone's signing up for it, right? Everyone's very excited to go that route.
Yeah. I do want to put a plug out there that, not all companies are created equal. You have to look at who is the founder, what are their values, what are their goals. You have to be careful that there's transparency. Do they list their physicians' first and last name? Do they list where their physicians went to medical school, residency, fellowship? Or do you have no idea? You don't know who took care of you. You don't know who will take care of you. You have no idea what your options are. And I've also seen other people not practice standard of care. A telemedicine visit should be everything that you did in person or would do in person to the best of your ability. So is this person pushing a particular drug or product? I just saw somebody push some vitamins and I was like, I've never seen a doctor's office push vitamins. Like, I will recommend that you take a multivitamin. I will recommend calcium with vitamin D. But to be like, here's a blah, blah, blah vitamin. Yes, no, like, no, no. And then you also have to realize that just because they got a bad Yelp review or a bad Google review doesn't mean that they're a bad physician. Sometimes as a physician, I have to be the bad guy. In obesity clinic, I have to yell at you because otherwise there won't be results, and you don't want to hear that. Or the other example I give is you come for a cold and it's actually a virus, but you want antibiotics. If I don't give you antibiotics, you're going to write me a nasty Yelp review. So I give you the antibiotics, but it's not going to help your virus at all. And then when you're 60 and you get a urinary tract infection or a blood infection and you use that antibiotic and it doesn't work and you die, that's not a good thing. So you want physicians with ethics. You want physicians who are academic. So I have little med students coming up to me and residents going, Dr. Yen, why are you doing this? The latest paper says that. And so if you're a person, the doctor you get is a generalist and I live, breathe, and prescribe birth control. I love birth control. It is my passion. And so I know the latest and the greatest. I know that Plan B won't work if your body mass index is 26 or greater. I know that this birth control pill will give you fewer side effects. But if you get a doctor who's a dermatologist or an eye doctor and they're supervising all this, you may not get that, right? So I would just want to make sure buyer beware, buyer be careful, and that we as digital health need to police ourselves, or we need to get, some audits or stuff like that, because I'm seeing some crazy stuff go down.
Thank you for sharing that. Well, Dr. Yen, where can our audience learn more about Pandia and maybe yourself? I'll throw it in the show notes as well, but
Wonderful.
I'd love to hear that.
Yeah, so please go to pandiahealth.com, PANDIA. Pan is every, dia is day, pandiahealth.com. And if you want to learn about hashtag periods optional, if you know anybody with a uterus that's bleeding 1 week out of 4, the cool information is we can turn that sucker off and you only need to bleed when you're trying to get pregnant. So how amazing would that be for everyone with a uterus and everyone around us who has to suffer when I'm bleeding? And so pandiahealth.com/periods optional. On the bottom is my TEDx talk that I gave for UC Berkeley on the science and safety of turning off your periods or having fewer periods. And then we are all over the social media. So on Instagram, Pandia Health, on Twitter, Pandia Health, on Pinterest, Pandia Health. I have my personal Twitter, though it's political, and therefore I have to say a disclaimer. Everything on there is not medical advice. Please check with your doctor and does not reflect my company or any of my employers, is my personal beliefs. Teen MD, but a lot of fun, a lot of politics there. And then as a public service during COVID, I've written a Pandia COVID blog, nothing to do with birth control, but just the latest and greatest, using my MIT background, my science background, my doctor background. And what I'm really proud of is the 120 public health measures that Taiwan took to contain COVID. Taiwan has the same population as New York State, and they've only had 7 deaths and 436 cases because they jumped on it and they applied all this public health measures. And if we had the political will and the right leadership in this country, we could have taken their playbook that they gave us on March 1 of 120 public health measures. And anyone can do it now who's in power or who wants to do good in this world and apply this, but very few have. So that's on our blog. And it also has Dr. Wang, who wrote that article for JAMA. He did a grand rounds for Stanford that has a couple of really cool slides on, like, how do you do a COVID command center? How do you handle PPE? How should you handle airports? So check it out, Pandia Health. Google Pandia Health and COVID. We also have a great YouTube station with tons of information on birth control if anyone has any questions. And you're welcome to hit us up on any of our platforms. We're here to help.
Great. Well, thank you so much again, Dr. Yen, for joining us on the Slice of Healthcare podcast. I'll put all that in the show notes, and we look forward to following the progress of Pandia Health and your career moving forward.
Thank you. I love this podcast, and I'm excited to be a part of it.
Thank you.